Welcome to Sandbox at Davos 2026, and with us today I'm very honored to present Munjal Shah from Hippocratic.AI, co-founder and CEO. So welcome to Sandbox.
Oh, thanks for having me.
So for those that don't know Hippocratic.AI, I think before going into the company, you've got an amazing experience as an entrepreneur. So if you can talk a little bit about your career, how it started, you've been to Google at some point as well, all the way up, leading up to Hippocratic.AI.
Yeah, so I'm a serial entrepreneur, as they call it. So this is my fourth company.
Okay.
I started my first company a couple years out of graduate school at Stanford. And then built that, and we eventually sold that to Alibaba. And then I built a second company in the computer vision space, and my graduate work had been in neural networks, and I'd done a lot of work in that, but this was all pre-deep learning.
Yeah.
And then we sold that to Google. It's a computer vision company that looked inside of photographs at the color, shape, and pattern of dresses and handbags and shoes, and would find you visually similar items, right?
Yeah.
So a novel way to search for aesthetic goods. And then I had a health crisis the day after I sold the company to Google. I ended up with chest pains, ended up in the ER. Like literally the money wired, I was high-fiving, and the next day I was in the ER. And so I also really hadn't taken care of myself. So I lost 40 pounds, changed my health, said, I want to build a healthcare startup because, and I built that, and that one actually didn't work out nearly as well. And then I saw ChatGPT come out, and I said, you know what, like, this is the AI I've been waiting for my whole life. It finally works, and now I know a little bit about healthcare. But this time I'm like, I want to start an AI company that happens to be in healthcare instead of a healthcare company that happens to use a little bit of AI, and so started Hippocratic right after that.
Oh, fantastic. Amazing, amazing. So you sold to China, you sold to the US, you've got that global experience. So we can drill down to exactly what you do. And I think you touched from our conversation to a very interesting sort of topic. Because once LLM came out, everybody were so excited about it.
Right.
And a lot of people still today consider LLM as AI. It's the same word, but we both know that it's very different.
Yeah.
And there's been a lot of voices saying, words are not enough. We need something more.
Yes.
And from our conversation yesterday, you talked a little bit about the accuracy and the level of hallucination when it comes to healthcare. Could you talk a little bit more about that?
Well, Karpathy has this saying, this artificial jagged intelligence, and I think people do not appreciate how right he is in this saying. These things can solve, math Olympiads, or, and yet they cannot count the number of R's in strawberry, right?
Yeah.
And we found this jaggedness on many things. For example, GPT-4o will hallucinate 23% of the time on scheduling. They'll just make up the appointment. You can't run a clinic where 1 out of 4 people is showing up and they're like, I'm here for my appointment. It's like, what appointment, right? So, this is things that you need that are basic skills that it doesn't have unless you do special work for it. And, we've done that.
Yeah, we find the same experience in Sandbox, and that's what we've developed LQM, the large quantitative models,
right?
Not as a replacement to LLM, but obviously as the heavy lifting for physical or chemical questions that sometimes these LLMs struggle with. And one of the approach that you've taken, which helped reduce a lot of those hallucinations that we talked about, is a Constellation sort of approach.
Yeah.
Can you talk us a little bit about what does that mean? Because I'm starting to hear more companies taking that approach.
Yeah. We pioneered this back in really July of 23. And we realized that the key to building Hippocratic was not to have one model, to use multiple. What we found was we had to solve the attention span problem. So in these models, people have increased the context window so you can have 1 million tokens. Have you tried putting 1 million tokens into the model? Like, it pays attention to the first 10,000, last 10,000. So what we found was if you split it up into multiple models and have each model only doing one thing, then you get the attention you need. And so we have a model that's looking at every turn, and it's like, are we talking about drugs? Are we talking about drugs? Oh, we're talking about drugs. Okay, now run. So it's what we call a detector evaluator architecture. The detector is a small model, runs fast. It's like, okay, do I even need to fire off the big model? The big model fires. We fire all 31 of these in a worst case scenario in parallel.
Yeah. So by running all these models together, you'll be able to take down the hallucination from the 23% down to?
On the 23%, I think we're like 0.16, don't quote me exactly on that, but I'm trying to remember from memory, but
Yeah.
it's sub 1% now.
Yeah,
sure.
that's amazing impact.
Yeah, and we see that again and again on every one of these horizontal skills. The Constellation architecture can do better than even any fine-tuned single model does.
Yeah. So you're in the healthcare business,
Right.
and actually in the care part of it, patient care. So the focus is, I would say, maybe less on the body, but more on the mind and the process sort of behind that. And so tell us a little bit more about how does this model help or improve the healthcare that we have for patient, or patient care, I would say.
You know, if you realize, well, two things. First, about a third of all time spent by nurses is on the phone with patients.
A third of all
A
time.
third. Yeah, almost all the time in motion studies seem to show this.
Okay.
And what are you doing during that time? Hey, ma'am, did you pick up the medication?
Yeah.
Oh, you need a refill? Let me put it in for you. But what if the AI can call every single day and say, today's instructions are to do this. Today's instructions are to do this. And so there's a whole host. But, you know, a lot of people think the key to improving healthcare is to build an AI that's a doctor and can diagnose. I think it's very hard to do that safely. Our issue is not diagnosing capacity, it's management. Because diagnosing high blood pressure is easy. Managing high blood pressure is super hard. People don't take their meds, they come on and off, it makes them dizzy, it makes them have, you know, dry mouth, like they don't love it.
Yeah.
And so what we need is a far greater amount of management capacity, chronic care management, than we really need. I mean, if we have both with AI, great, but we definitely need a lot more chronic care. And that's really what our AI does, is it focuses on all of those activities, encouraging you to do it, explaining why it's important to do it, explaining why you need to come in for that CT scan. You know, even though for the last year since we found that last lung nodule, you feel fine. I get it, but you're not going to feel lung cancer until it's too late. And the AI literally explains that to people.
Amazing.
But actually the big idea here is it's not about whether you're getting a human or you're getting AI. It's about the nothing compared to AI. Because 99% of the time, nobody's calling somebody to check in on their blood pressure.
I see.
The biggest power here is abundance, is that the things you would have never thought to do until you had an infinite supply of clinicians at a very low cost, you know, that speak every language and remember every patient and can memorize every clinical trial. Like, that's a big idea.
It's a big idea, and it can scale easily across sort of regions and countries, and not only in the developed world, also in the developing world.
That's right.
So I know we need to sort of wrap up. So just a few words on your recent acquisition of Grove AI and the future for Hippocratic.AI.
Yeah, you know, I think we raised this recent round exactly to do some of these AI acquisitions. And so we're starting to do some. We'll announce more coming down the pipe. But look, in general, you know, we've been able to bring this product to market only 18 months ago. And almost 50 health systems, over 2 billion payers, and pharma have bought the product. We have 5 of the top 20 pharma. We have, I think now, 4 of the top 6 payers, and more coming. And so when we look at it, we go, you know, what's working? Well, it's a very easy value proposition. It's like, hey, what's it currently cost you to reach out to people and make sure that they're taking their blood pressure meds? Oh, well, we have a whole team. We have 30,000. It's actually one payer has 30,000 people. This is what they do.
Wow.
And I'm like, yeah, I'm pretty sure we can save you money on that and probably do it better and do it more efficacious. And so, you know, we've just been scaling the company and trying to keep up with kind of all the projects we have going on. So.
Fantastic. Thank you very much for your time.
Yeah.
Great work.
Yeah, thank you.